My clients first came in, they're mostly looking for pain relief. I mean, most people seek chiropractic care most of the time as a last resort. They'll try lots of other things that don't work. And so a big part of my initial visit with a client is they're looking for some kind of reduction in their symptomatology. Very, very common. Some people actually walk in the door saying, "Doc, I really want to just function at my optimal," but that's not a big part of my client. So the base kind of get there over time. But to start with, they're looking for some kind of neck pain, back pain, relief, whether it be headaches, sinus problems, sciatica. It could be various symptomatology, and they're looking for me to help them with that. And they're trying to do it in a more natural way without drugs and surgery and various things that they don't want to do. So that's pretty much very common for me. It varies. I've been on the island full time now about 6 years, and so people sometimes come to me first. Or they sometimes come to me after they've been to the whole medical community here. A lot of times they've flown off island and tried to get second and third opinions for their issue, and then they'll seek me out, or they'll see me at some kind of health event and they'll ask my opinion, just looking for knowledge. They kind of just want to know. They want to know what is wrong with me and what do I have to do. They tend to be pretty compliant. If I can give them an honest understanding of what their problem is, and I can show them a logical way forward to actually fix their problem, they tend to be pretty compliant. Sometimes the people in the States, they think they know more, and they may not be as compliant, but found on St. Croix that most of the local population will give me a shot, and they tend to trust me because I'm being honest about their problem and what I can do with them. Most of the societal issues today about contributing to all kinds of various pains is the way we live. I mean, between phones and computers and our lifestyle, everything is rounded and forward-centric. Everything is this. When you're on a computer all day long, you're like this. Okay, especially if you're not paying attention to the proper posture and having a proper ergonomic, workstation, you're pretty much damaging your spine. Or if you're on your phone, nobody's looking at their phone in the proper position with like this. They're pretty much looking face down, and everything is forward and rounded. But that's the opposite of proper posture and proper health. Everything with proper posture and health is shoulders back down and chin backwards in this position. So when we start rounding and going forward, we retrain our spine to be in the wrong position, and over long periods of time, it becomes our norm. So now your spine is in that position, the muscles have reconformed to that improper posture, and your health starts to deteriorate over time. So as a chiropractor, physical therapist, and so forth, we're trying to restructure the soft tissue to be in its correct position again, and then teach you certain ways to keep it that way. So, the phone's a good example. The computer's even a better one, but the phone is a good example. So, no one's going to hold their phone up to their face. No one's going to hold the phone up. Everyone's going to hold the phone down, and they're going to be in this position. They're going to be using their phone this way, typing, looking down, forward and rounded. Okay, so that's just really, really common. Okay, some people might be on their bed, doing certain things, but everything is pretty much in this rounded position. You have to offset that. I'm not going to tell you to hold your phone straight up to your face, but you have to offset that by doing certain postural exercises to counteract the 20, maybe not 20, but 8 to 10 to 15 hours a day that you're kind of like this, forward in this position. And the main reason why that matters is your head weighs about 10 to 15 pounds, right? So your spine needs to be in a certain position to keep your head over your shoulders and your ears over your shoulders, so that the weight is distributed properly and it's not going to be exaggerated. But if your head in this forward posture and your shoulders are rounded, your head no longer weighs 15 pounds, it weighs 40, right? Because you're now in this position. So years and years of an improper neck position, I've taken tens of thousands of x-rays in my career. I always see degeneration in the neck when people have lost the curve of the neck, when the neck is going too far forward. So you must bring that neck back to get the weight behind the bones instead of in front of the bones, not to get the arthritis and all the different disc issues, and then the headaches and all the other problems that come along with the degeneration of the spine. So my name is Dr. Anthony, and so I've been on island now full-time for 6 years. Pretty passionate about chiropractic. I've been doing chiropractic for 20, 25 plus years. I've had several practices back in the States, and now I've been on island, like I said, for about 6 years. Clinic director here at Beeston Hill Health Wellness, doing the chiropractic and various things. I run the chiropractic and the physical therapy department. So I coordinate your healthcare here, and I can make sure we figure out the best way to get you better. So I'm very passionate about chiropractic, been doing it my whole life. It restored a lot of improper function I had as a child, and as I grew up, I went to chiropractic myself, and it made me very passionate about what chiropractic could do for overall health and wellness. So I'm looking to bring it to everyone here on the island. Here at Beeston Hill Health Wellness, I'm very blessed to have a very smart, talented team. Okay, I have Paul Lavora, who's my lead physical therapist, and I have various other people in my rehab department, from certified athletic trainers to personal trainers, to be able to work with hand in hand to help restore somebody to full health. Because chiropractic is not the only thing that people need. People need chiropractic, but they need it integrated with other things. So I can take a bone and I can move it from one position back to another position, but if it's been in the wrong position for years, it's just going to go back out of place again. So I retrain the spine to be in the right position by frequently seeing people, but I also work with my whole therapy team to do all kinds of postural corrective exercises, functional movement exercises, and then to graduate them from more of a sickness kind of place to where they start to get better and start to function well, and then we move them on maybe into the gym where we teach them how to actually exercise properly so they don't re-injure themselves, and we take them more from a sickness to a fitness model over a longer period of time, and they're pretty much guided every step of the way. So I really love this facility because I have everything at my disposal. Anything from, like I said, a chiropractic, physical therapy, a full gym. I have class 4 laser. I have all kinds of decompression therapies like DRX 9000. I have a full pool. So I can do aqua therapy for people who aren't ready for land work yet because they are just in too much pain and they just need a lot of gentle decompression. So I have a lot of tools in my tool belt here to be able to coordinate someone's healthcare plan and really get on the road to positive health. Sure. So when you come here for your first visit, the process is pretty specific. It takes a while. It takes us a good hour to an hour and a half on our first visit. So we do our new patients on Tuesdays and Thursdays, so we can spend a lot of time with our new patients. And then, so I might be spending a full hour, hour and a half with somebody, doing the history, really sitting down and listening to what your problem is. I mean, most people, they need to tell, what's going on. I need to hear how it happened, how long has it been going on, what makes it better, what makes it worse, what kind of symptoms you have, where did it come from. These pieces of information during the history are very, very important, and I need to listen to what you have to say. Okay, and then after the history is done and I have a good understanding about what happened, then I have to do an entire evaluation. I have to do an entire examination. I have to examine the spine. I have in-house x-ray, so I'm most likely going to take an x-ray of a problematic area. And then I also have an entire other team, like a physical therapy department, that they're also going to evaluate you. So you're not only going to have one person evaluate you, you're going to have several. And I want them to evaluate you to see muscle tone, weaknesses in different parts of the muscles, different range of motions that it may not be optimal. I want them to evaluate you as well because I get the best clinical results when I combine the care, when I'm having both chiropractic and some kind of therapy done at the same time on the person. So we can run you through various programs to get you to that functional state that's not just pain-free, but optimal functioning. So a lot of people come in pretty broken. So when you take a journey from sickness to fitness, like I said, most people are coming in pretty broken. They've allowed their health to deteriorate to the point where they have a lot going on. It's not just a neck pain. They might had neck pain, might have drove them through the door, but usually that's not the first thing. There's an underlying iceberg underneath that little tip of the iceberg that's pain. There's an underlying problem under there, and it takes a little bit of time to uncover the problem and get to the cause of that problem. So when you come in pretty sick, you come ill, you come fairly broken in your injury, and from there we need to baby you. We need to first do some palliative care, get you out of this chronic pain loop that you're dealing with. Okay, then once we get you out of the chronic pain loop, then we're going to take you more to a functional model where now we're going to rehabilitate the tissue. So the tissue is no longer in a not a disease, but a dis-ease state. It's not working properly, and we're going to get you to a state where it's functioning well. And now when you're functioning well, your symptomatology is almost pretty much behind you. Now it's the fitness time. Okay, now you got to get stronger. You got to get, you don't want that coming back. Okay, and you want to get your whole body just in a more optimal position to be able to handle the stresses of life. So now we're going to teach you proper ways to eat. We're going to teach you proper ways to exercise. We're going to teach you things you shouldn't be doing, right? So you're not going to deteriorate back to the place you were before. So sickness to fitness does take time. Yeah, I mean, everything. So the journey from a sickness to a fitness model, when I first see somebody, they're, like I said, they're usually pretty depressed. They just want to be out of pain. And then once we get them past that pain loop and they see other people in the facility who've kind of maybe towards the tail end of their program, okay, and that's where the magic is happening. Okay, so now they're really starting to get stronger, and they're playing with their grandkids more. They're taking the long walks up the hills, or climbing the mountains, or doing bike riding, or swimming. They're doing more of the things, the reason you want to be healthy. I mean, yes, pain-free feels good, but most people want to be healthy so they can be active and be able to enjoy life. So when you get to that other side where you're now active and enjoying life, that's the special place. That's the place that we're all looking to go for, and that's what we try to do here at Beeston Hill Health and Wellness, to get you to that place. Yeah, so I was actually looking over some of the testimonies the other day, and I was pretty surprised. We have 500 plus testimonials, and everything is 4 or 5 star, mostly 5 star. Every once in a while I see a 4 star. I haven't seen anything even lower than that. So obviously we're hitting the community in a really positive way. So when I'm looking through all those testimonials and I'm seeing people, names that I recognize, because their patients have either been here a short time or a long time, and I can definitely see the difference in their life. Okay, I mean, this is a small island, so you know everybody. So you see people out in the world, you see people out at the beach, and you kind of then, say, hey, how have you been? How's your life been? How are things going? And, most of the time, things are pretty positive. So I'm very, very proud of the work we do here at Beeston Hill Health and Wellness. Yeah, of course there are people who choose not to get care. There are definitely people who choose to not, put their health as their priority, and that's not really for me to say. I mean, I try to meet people where they're at, but in my experience, when people don't put their health as a priority and they don't choose care, they deteriorate. They completely deteriorate. They end up going from, some small pains here and there to more chronic pains, to chronic headaches, to chronic problems, and then they come to their ends rope, and then they end up doing a lot of drugs to try to relieve their pain, on a daily basis, which causes all kinds of issues from anything. A lot of them is stomach. You'll get ulcers from taking too much medicines, too many painkillers. I find this island doesn't really prefer to go the drug route. I find most of the people on this island do want to go more of a natural route to try to get better. But if you wait too long, it's just harder to fix. It really is. And sometimes it's impossible, right? So when I get somebody in their 20s, 30s, and 40s, it's much easier to fix their problem than I get somebody in their 60s and 70s who's neglected their care all their life. So obviously it's just, it's on a scale, but I always recommend people get checked early. Make sure your spine's in a decent position. Make sure your health is fairly good. And if you don't need care, great, you don't need care. But you should always get checked to make sure. I mean, out of all the people living in the island, Beeston Hill's for everybody, for the most part. I mean, we have everything you could possibly imagine in this facility. For people who move a little slower, they might need pool work. People who are a little bit sicker, they might have to start out with a lighter kind of care. And then there are people who can start out more aggressively. We have a full fitness center, so there are people I can get right into the gym right away, really starting to strengthen their muscles. But for the most part, it's everybody from young to old. So as a chiropractor, the youngest patient I ever had has been 2 days old. Okay, and most people don't realize a chiropractor can see a 2-day-old, but we can. Adjustment on a child is very, very light. It's more of a vibration than it is actually a force. But kids fall and hurt themselves all the time, so really much from young to old. Pretty much you'd want to have, anything in between. So chiropractic care and Beeston Hills for everybody. So many times you'll see me around the island. I do all kinds of different health events on this island. We just did a WAPA health event. It was, I think it was entitled Don't Gamble with Your Health. So we did a WAPA health event, and there were many people who saw me there that took advantage of my knowledge and sat down and just discussed some of the things that they were dealing with. I do have this thing called the Titron. It's a infrared scanner. So I can roll it on your spine, and infrared beams will go through the holes, go through your skin, go through your muscles, land on your nerve roots, and give me a good reading of what's happening at the nerve root level right at that moment. So it's a good jump off point for me. So if you're having, a lot of nerve pressure very, very high in your neck, I'm probably going to ask you how long you've been dealing with headaches. And they're going to go, how do you know I've been dealing with headaches? I'm like, because you have a strong amount of nerve pressure at the top bone of your neck, and it's very common for things like headaches, sinus problems, and allergies. So they think I'm like a guy at the carnival who just guessed their ailment, but all I did is I know where that nerve goes, and I know that nerve is being interfered with. So I'm just asking if you're having symptomatology that corresponds to that area. So that's usually my starting point, and from there, if we have things that I know I can help with, I invite them into the office where I do a much more thorough evaluation, where I'm going to then check the position of the bones. I'm going to check the muscles, the muscle tone from side to side. We're going to talk about all their health problems, and I'm going to put all that information together along with their symptoms and my nerve scan, and I know exactly how to start treating them. So I do a lot of external events just to introduce myself and introduce what I do to the island, and it could be anything from something like I just did at a WAPA health event. The other day I did a health talk where I did a whole nutritional talk. I'm basically a meat-based eater. I've been either paleo, keto, or carnivore for about the last 12 years, and I truly believe in a low-carb lifestyle. Especially on this island, diabetes is rampant. I've never seen more diabetes anyplace than on this island, okay? So low-carb lifestyle, I think, really should be adopted on this island to get rid of the diabetes, or at least get it under control. So I gave an hour-and-a-half presentation about low-carb lifestyle and how to gently start switching over from a high-carb lifestyle to a low-carb lifestyle, and the food you need to eat and the different medical conditions that you might be dealing with and so forth. So I do lots of different talks all over the island to be able to just educate people on certain topics. So here on St. Croix, like I said, I've been here full-time now 6 years. One of the most prominent things like I see is definitely diabetes. It's a big problem on the island. So people come in, they're not coming in saying, Anthony, help me with the diabetes. They're going to the medical doctor for that. But when they come in and I do my health history, I find out that they either have type 2 diabetes, they're on some kind of medication, it has a familial component, whatever it might be. And I'm taking that into account as I'm putting them on a treatment protocol, okay? But one of the biggest things that I see that actually surprised me on this island is the amount of scoliosis. There is a large percentage of scoliosis for the population on this island. Like I said, I've taken tens of thousands, if not 100,000 x-rays in my chiropractic career. I've taken a lot of x-rays, and I've never seen the preponderance of scoliosis as I see on this island, for especially in adults and in children. It's like every third person I take an x-ray on has some kind of scoliosis, and it really surprised me. I don't know the reason for that. The only thing I can think of is back in the States, the nurses in the schools monitor for scoliosis. I don't think they do here. But even if you're monitoring for it, you might catch it early, but it's still there. I don't know why. I don't know if it's a genetic component or not, but I do see a lot of scoliosis. So I think all the children need to be checked chiropractically, okay, because of the rampant scoliosis on the island. And so everyone should get checked chiropractically. If you have scoliosis, it has to be monitored properly, and there's definitely chiropractic techniques that could slow it down. And I've never really corrected a scoliosis. It's really hard to deal with, but you can deal with the symptomatology, and you can slow it down, especially before the growth plates close. So usually around 18, males and females close at a different age usually, but anywhere between 17 to 19 to 20, the growth plates kind of close. So, but when you're in middle school, when you're in early school, you should definitely get checked out. So here at Beeston Hill on St. Croix, pretty much I get a lot of people that have headaches, very, very common, super common headaches. Again, head forward, typing at the computer all day long, doing it incorrectly, improper workstation, okay? Very, very common for headaches, very common for neck pain, upper trapezius pain, all these muscles here, very tight because they're always rounded. They're doing this, okay? Very common. Low back pain is common, and sciatica is very common. I have a lot of sciatica patients where they're getting, shooting pains down the back of their legs, and that's one of the things that we have here that I like a lot is our DRX 9000. It's a very complicated decompression device that really opens up the space between the bone and the disc and helps create a negative vacuum to pull the material back inside if the disc is the issue. And we have about a 60 or 70% success rate to stop surgery. So I really like our decompression device here in Beeston Hill Health and Wellness. The main reason Beeston Hill Health and Wellness stands out in the crowd, I believe, one, it's size. I mean, it's a 30,000 square foot facility. It's got to be the largest health facility in the Caribbean, not just the U.S. Virgin Islands. So we have everything. So that's the main thing. And the other thing is the people here that are definitely all in on trying to get everyone as healthy and functioning as the optimal level as possible. Just all the different modalities and things that we have at our disposal. I mean, like I mentioned before, we have traditional chiropractic, chiropractic adjustments, hot packs, cold packs, electric stem, ultrasound, to the physical therapy department, and then class 4 laser is great for speeding up the healing process. Neck and low back decompression therapy, aqua therapy. It's real rare to see on the island, and we have a full-size pool, so we have aqua therapy as well. So between all of these different modalities, and then having a full access gym to be able to take somebody once we get them, to a good functional place, to then go to that next step to get you to that fitness place, and we have a full functional gym and personal trainers to make sure that you do it right. I think it's a no-brainer to come to this location. So if someone's actually considering coming to us and taking that first step, it's really easy. All you have to do is make a phone call and call us here at Beeston Hill Health and Wellness, and we'll get you on the schedule. We do new patients Tuesdays and Thursdays, and we have room for everybody. And then just come on in and allow me to sit down and just discuss with you what's going on with your health. Okay, there's no pressure. Okay, I never tell people what they need to do. Okay, everyone's on their own health journey. Everyone has their own priorities in life. Okay, I'm going to share my knowledge with you. I'm going to tell you what I found, and then I'm going to share it with you in a way that we can both understand. And then you're going to make your own educated decision on what's right for you. But at least you're going to have all the information so you can make an educated decision and not, just make a decision without knowing all the information. It's really important to know what's wrong before you can decide whether you even want to try to take care of it. So the first visit's really, really easy. We're going to have a gentle conversation. We're going to find out what's wrong with you. I want to know what your goals are, what you're looking for. Are you looking for pain relief only? And if you are, I'm not going to tell you no. I'm going to help you just get out of pain. But if you're looking for increased function and a more optimal way to live, I'm also going to take you through that road. So we're going to work together and make that educated decision together to see what's right for you. We've already discussed it, okay? So the main thing I think that distinguishes us and why people should come here is because we're a fully integrated wellness center, right? Other places don't have that. They don't have fully integrated wellness centers. We're a fully integrated wellness center with every tool possible to get you from point A to point B to point C. It's really as simple as that. And we're going to guide you every step of the way. You're not going to be doing it alone. So I'm Dr. Anthony. I'm the clinic director here at Beeston Hill Health and Wellness. And I just want everyone here on the island to know that I feel that Beeston Hill is the best place to go on the island. We are a fully integrated wellness center. Right? We have everything you could possibly imagine, every tool in our tool belt to take you from sickness to fitness. We take you from point A, point B to point C, and we hold your hand and guide you every step of the way. You're not going to be alone. This is the place to get health and healing.